Well, hello everybody. Self-isolating. This is my third day now. I feel absolutely shot. It's not like a cold or a flu I've had before. So this is more of a warning, if you want, or an urgency on your part, that you have to take everything that you possibly can in your own hands and protect yourself. If you have to go out, ensure you get yourself a mask and wear gloves wherever possible. You know, those plastic disposable kind. Doesn't mean you have to wear them all the time, but at key times, like going through mass transit exits, i.e. doors. This coronavirus, I'm not entirely sure I have it. I've not got myself tested. But I'm following the government guidelines, which are, if you're showing signs of a fever and a new cough, then self-isolate yourself. This pandemic is going to be incredibly scary. Latest forecasts are saying that there are going to be somewhere in the region of 80% of the population, and that's within the UK. I can't say for the rest of the world. Will get it. At what level they'll get it is anybody's guess. But you have a responsibility, both to yourself, to your friends, to your family, and to your colleagues, to protect yourself. Now, my symptoms now have been at the same steady rate for the last 3 days. There's been no improvement whatsoever. I wake up in the morning, I have a coughing fit, clear my chest, and then that settles down. I ache, joints ache, I'm constantly cold. I haven't eaten properly in 3 days. I suppose that's one good thing. I get to lose some weight. It's not exactly the way I would have wanted it though. Headaches, tiredness, I haven't really got a snotty nose. You know, first thing in the morning I may blow my nose a few times and clear the residue of crap that's in my nose, along with clearing my chest. And once that's done, I don't really cough a great deal. Maybe 1 or 2 times an hour, which isn't great, which isn't elevated, I should say. Now, what can we draw? What can history teach us? Now, there's probably a lot of you who don't even know that something called the Spanish flu ever occurred back in 1919. But the Spanish flu started off as a mild flu, mild flu symptoms. And the majority of people would recover. Now, the final years of the First World War was still around. And that was great breeding ground. Lots of men in a close proximity to each other. And what happened with the Spanish flu is initially nobody took it seriously because it was a flu. America, I understand, was dealing with the measles epidemic. So they had their hands full. And by the way, that's exactly where it started. That's where it originated. And why it was called the Spanish flu was because of the First World War press censorship. All countries involved in the First World War were quietening things down because they didn't want the opposition to know that they were dealing with a health problem amongst the civilian populace. But in Spain, there was no such press censorship, and they wrote everything that they possibly could, saying how dangerous it was. So that's where it became the Spanish flu. And why it was so dangerous is because nobody took it seriously enough initially. And the flu bug, the Spanish flu bug, virus should I say, morphed and became deadly. It started killing people far more readily, and not in the usual age groups, which was the young, the infirm, and the elderly. It was the young and the healthy that were being targeted. Now, I don't know the timelines of this, but I do believe that it morphed for a third time. When it morphed into the third time in its the deadliest strain, reports were going out that once you were symptomatic, i.e. you showed the first signs of being ill, death was a high probability. And in some cases, not the majority, but in some cases, death occurred within 12 hours. Now that's incredibly scary. Now, I don't think the coronavirus is anywhere near that just yet, but we don't have a vaccine. And the professional view is we won't have a vaccine for another year. So what can we do to stop the spread of coronavirus? Stop socializing, as hard as it is. And as hard as this is going to be for a lot of you, stop socializing. Don't get yourself in a situation where you put yourself at a high risk of contracting COVID-19. If the populace can stop going to the pubs, I know it's going to be bad for business. And I'm suffering myself because I'm self-employed. But believe you me, I think we have to be this radical in our approach. Already, the government has put a ban on mass public gatherings. Concerts, football matches, rugby matches, anywhere where a lot of people are going to come in contact with each other. If we can do that, and we can control it at this stage with those precautions, the likelihood of this spreading will have been marginalised or minimalised, whichever way you want to look at it. I don't know. Take Wuhan in China. When they imposed martial law, the spread of coronavirus decreased exponentially, and very, very rapidly. Italy is in lockdown. You must take responsibility for yourselves and don't wait for the government's guidance. This is a pandemic. The World Health Organization, has classified it as so. That means there's a great chance of you catching it, whoever you may be. More than likely you will become symptomatic at some point or other. To what degree your symptoms will show, I don't know. But why risk being part of the 20% that will need to go into ICU? You will cause strain on an already strained National Health Service and your own public health services wherever you are in the world. This is dangerous. Look after yourselves. Bless you all.